Hey guys, how's it going? My name is Shashank, and thank you for tuning in to Tackling the World for today's topic of universal healthcare. To make our first podcast episode extra special, we have not one but two amazing guests on the show for you. But before we do start, I would just like to let everybody know that our podcast is now available on every major streaming platform, such as Spotify, Pocket Casts, or Google Podcasts, and many more. We are still waiting on approval from Apple, so you should be able to stream from them very soon as well. So let's get straight into the episode. Our two guests today are Jasmine Holt and Colin Burfiend. They are both juniors in high school, and they're going to be sharing their perspective on healthcare with us today. So it's my pleasure to welcome Jasmine and Colin. How are you guys doing?
Pretty good. How about you?
Yeah.
I'm doing fantastic. Awesome. Well, I'm so happy you guys are on the podcast. It's been a long time coming, and I'm super excited to get this first episode started off with you guys. So are you guys ready to get into it?
Yeah.
Yeah.
All right, perfect. All right, I know I can see we're all a bit nervous, but let's see how well we can handle this together. So before we start, I just want to. Oh, what?
Oh, sorry.
No, you're good. You're good.
We're just starting.
What?
Oh, never. Oh my God. Just keep going.
No, you're good. All right. So just for the not viewers, just for the listeners who are tuning in, if you guys don't know what universal healthcare is, I'm just going to give you a quick a definition from the World Health Organization. Universal healthcare coverage means that all people and communities can use the promotive, preventative, curative, rehabilitative, and palliative health services they need or sufficient quality to be effective, while also ensuring the use of these services do not expose the user to financial hardship. So this is the basic definition that the World Health Organization, which is obviously very well known all around the world, has given us. So before we get into the really controversial but important topic, I just want to give Jasmine and Colin a couple minutes to explain their stance on universal healthcare. So which one of you guys want to go ahead and give us your stance?
Go ahead, Jasmine.
Okay. I'd say that if I just talk about like my stance specifically on healthcare, I'm generally a more independent person, so I don't consider myself Democrat or Republican, but I am on the left and libertarian side. I guess I'd say in healthcare, I closely align with Bernie Sanders' idea or vision for America's future in healthcare is to provide everyone equal access to healthcare, no matter your age, economic background, race. I just think that healthcare is a basic right, and our policies should reflect that.
Awesome. Thank you for that. That was very good. So it looks like you're a big Bernie fan when it comes to universal health care. Yeah. So Colin, you want to go ahead and give us your stance?
Yeah, so I'm also on the libertarian side of things, slightly to the right though. Healthcare is one of the issues where I do tend to lean a little bit left though, although I'm not as far as Jasmine into the left. So my stance is that definitely we could make improvements in the U.S. Moving slightly towards universal healthcare, although, like I say, probably not to the extent that Jasmine would want. But I'm also personally really into technology and science, so I think that innovation is something that we should try to uphold and improve as much as possible.
Awesome. Thank you. And I just want to quickly ask a question, based off of your original statement. You were talking about, making some improvements into American healthcare. This subject is talked about all the time by many politicians, the left and right, saying it has to be this way or it has to be that way. So as you may know, the healthcare system in the United States is a mix of four different models: the Beveridge model, the Bismarck model, the National Health Insurance model, and the out-of-pocket model. So those are the four models that our healthcare system is run on. So you were talking about there needs to be some changes made to our system. What are those changes, and how would you think politicians should implement them?
So I think personally the biggest issue that I see is definitely the high costs, especially to people that can't take care of them. So that is where I think somebody with Jasmine would probably have more of a political view on that. I definitely think that dealing with managing costs, especially no matter who is going to be taking care of healthcare, whether you're choosing from these four systems, you're definitely going to see gains by reducing costs all throughout healthcare. So whether that's the drugs or the tools, just the general quality of the healthcare. And again, I think that it should. Dang.
No, it's all good. Take your time.
Yeah. So I think underline everything that's going to be more helpful no matter what route you take, basically. And I think that a lot of inefficiency and corruption could probably be dealt with to some degree.
Okay.
And yeah, I don't have
yeah,
so
I mean,
much.
that's
of a,
yeah, I
yeah, go
mean,
ahead.
that is a really good point with corruption since our healthcare system is run by the private sector, basically, except for Obamacare, which is still trying to be alive. But so as I was doing some of my universal healthcare research, I came across obviously the national health insurance model. This is the model that countries like Canada or South Korea and Taiwan use, for instance. It's similar to Medicare in the U.S. It's basically Medicare for all, but not really. The government there pays for all of the services the patient receives, but I believe like some things like dental care and I think eye care are not covered by the government. So there is a little bit of a private sector, I believe. Yeah. So yeah.
Does include like dental care and like eye care, specifically when it comes to like senior citizens. And
Uh-huh.
I think that basically the main point that Bernie Sanders and strong supporters of Medicare for all, is trying to argue is that universal health care and Obamacare does provide that public sector, but it's more of like that small sector that is just like, it's kind of like a facade, basically, is how I view it. It's like we have this option, so you can't really complain because if you have both, we can both be happy. But what's the point in having both if you still have that private sector, which is draining all the money that could have been going into research and development in the first place? You either need to just go on full on corrupt and just admit you're just full on private and just like handle the money there, or you can go the more moral route and just have an all out public system where the people get the most benefits. And okay, basically it's basically the argument where the people in charge of these health insurance companies, the people taking money from the drug companies, whether or not that we're going to take their benefits away from them.
Mm-hmm.
Honestly, you could put sympathies towards those people, but honestly, for me, I have no empathy for those people. They put all those money into these industries. If they get taken, then let them be taken out.
Yeah, I mean, I see where you're coming from. But when you have a split sector, like private and public, what some people suggest is that if you don't like the private sector, just switch to public. So that way you're not giving money to these, these corrupt businessmen who are trying to make lots of money through healthcare. What do you think about that?
Yeah, I think it's kind of like along the lines there. For example, like Elizabeth Warren, was one of the Democratic candidates, and as a progressive, for example, her her work on Wall Street is something I extremely admire. But obviously, her candidacy did not last as long as another progressive, Bernie Sanders, purely because there's a stunt in the polls once she announced her own personal Medicare for All program, which wasn't a Medicare for All program. It was something like we have kind of now, but more progressive, where we would just expand Obamacare. But honestly, the people don't fall for that crap. They know that if you have both, it's nothing. You still have the private sector and you still have the drug companies still trying to make the most money possible. And as long as you have corruption in the system, they're going to be controlling everything. It's as if we don't have control over our own health. And that's exactly why Elizabeth Warren stunted, because the whole progressive base basically turned against her, because Medicare is this one thing that you can't screw around in the progressive base, because we all believe that everyone has the right to have it.
Yes, and I'm a strong believer that everybody should have the right to healthcare, and nobody should have to sell their house or live in a dire situation just to get a surgery or something like that. But maybe Elizabeth Warren is onto something with her plan. You say that it's more that it's Obamacare, but it's going towards the progressive bit. Now we saw that Bernie Sanders recently dropped out of the presidential candidate race because he was told that he would not have enough delegates. And after talks with the Joe Biden camp and with former President Barack Obama, they've come to a decision to just drop out of the race. Now, the way that I see it is that in the past, the people who are the most average on the spectrum, so people who are not too left or too far right, usually garner the most support in the system. So maybe trying to slowly implement progressive ideas into our government might be a better route than just to put everything out at once and expect it to work or expect people to agree with it. What do you think about that?
I want to bring Colin into this conversation quickly, but
Mm-hmm.
basically, if moderates were working so well for us, why did Hillary Clinton fail so badly against arguably one of the easiest presidents to beat? Not saying what you can say about Trump, I'm going to keep my opinions of Trump out of it, but he was a completely new candidate, someone that many didn't believe could be a president. Hillary Clinton was the traditional presidential figure. It was basically set up for her, but she still lost. And
Yeah, and a lot of people do say that, and I agree. I mean, I'm not necessarily the biggest fan of Clinton myself, but usually what I like to say is that you either have presidents like Barack Obama or you either have presidents like Donald Trump.
But you
You
see
have
that Barack Obama ran a more Bernie Sanders campaign. He specifically talked to the lower working class, not the higher white liberals who already aligned with his base. Obama basically put on a Bernie front. In fact, he was seen complimenting Bernie Sanders' ideas way back. And Trump also had a very similar campaign to Bernie Sanders, specifically gearing towards the working class, saying, I'll drain the swamp, even appealing towards Medicare for all ideas. He was arguably a more working class candidate than someone like Hillary Clinton. And also,
Mhm.
honestly, Joe Biden is a little bit more working class just because of his own nature. But I think Trump is even more so than Joe Biden. And I think Colin might be able to say, as someone who I I don't know if this is exactly right, but I think you supported Trump in 2016. But did you see
Yeah.
that part of his base of him gearing towards some Bernie Sanders elements?
Oh yeah, for sure. And I mean, even now you can see that some Bernie supporters are okay. Trump is going to win, and I'm fine with that compared to Joe Biden winning. So I think that people in America they would prefer some kind of change at this point. So they see the candidate like Hillary Clinton or Joe Biden, and they're like, you're just going to muddy the water until corruption and waste is the only thing that there is left in the government, and I want to change that. They look to Trump draining the swamp, or they look to Bernie Sanders. He's pretty out there compared to the rest of the candidates. He has ideas that nobody else is willing to give because it's so like controversial to many Americans to put the ideas of socialism out there. And Trump was also pretty controversial, and I think people actually like that, and more people are growing to like more drastic change. So that kind of centrist model, it does appeal to a lot of people, like Jasmine said, but I think that there might be a growing amount of people that would prefer a slightly, at least, more extreme model.
Yes, and
Basically,
oh
sorry,
yeah, go ahead. No,
just to
it's fine. Go
summarize
ahead.
it and close it, it's like basically, I think the Democratic Party saw this Obama win and is basically piggybacking onto it, saying we just need to elect another centrist. They're gonna say that for the next, I don't know, couple years, couple decades. But in
Mhm.
reality, Obama didn't run a strictly moderate campaign. They're just trying to twist their own words and just control the people the way that they're used to controlling them with. That's it.
All right, awesome. Thank you guys for your perspective on that. That was some good insight into some of the candidates and how this liberal movement is going and how voters need which way voters need to turn to bring some real change. And I just want to come back into the hard topic of healthcare here quick. I have some questions already pre-planned, as I've mentioned, told you guys before the recording. I'm just gonna start asking some of those and see what you guys think. So some basic question. So when you look at universal healthcare, what services do you think should be included when you receive healthcare from the government? And I would like both Jasmine and Colin. And Colin, if you could go first.
Sorry, what was that? My internet was just gone for a second.
Oh no, you're fine. So what services should be included in healthcare?
Oh gosh. Whew. I actually. Oh gosh, I don't know if I could go quite far as to say what every single service should be, but I would definitely argue for specifically America focusing on increasing health, so preventative care more than just take this pill
Mm-hmm.
for the rest of your life because you've already screwed yourself up so much. So I
Yeah.
think a focus on improving the health, improving the diet of Americans would actually cut down costs a lot, and it would also improve the general quality of life and health of America and improve healthcare
Mm-hmm.
by that. I think that's
Okay.
pretty important in any system. So
Awesome. That's great. Jasmine, what's your take? Let's just simplify the question. Like what major services should be included? Not every single one. Like what major ones should be included?
Senior care, dental care, eye service care for like people who would usually use Social Security, just like healthcare in general. Like
Mm-hmm.
you basically, it's just I think Medicare for all. It's not necessarily just like handing pills out to everybody, as like a lot of people try to demonize it to be. It's just a way to get people not to die. Basically,
Uh-huh.
like 26,000 people die per year because of lack of healthcare. And that's from the NCBI, if I need to like state out the statistics.
Mm-hmm.
But basically, it's just minimizing that, like just making sure that people can live normal lives and participate in our economy like a normal citizen,
mhm.
and
Mm-hmm.
just keeps the economy going, basically.
I
All right.
actually
Mm-hmm.
sorry.
Go ahead.
I think that that point about letting just people live their normal lives and participate in the economy through providing better healthcare is actually one of the more convincing arguments to a lot of people, including myself, that
Mm-hmm.
even if you don't buy into the ideas of universal healthcare or Bernie Sanders, you could agree that if people were in better health, they could be more productive and thus improve the economy or just America in general. So
Yeah,
yeah.
and that is a very good point. America is not known to be the most healthy country in the world. Fast food changed, but uh, America tries its best, and that is really a problem.
Do we try our
Where
best
we
though? Do we?
no, I mean, I don't know. I mean, the American healthcare system, it does need change, and keeping people healthy is proven to show that if you have a lot of healthy people, your GDP is gonna grow, your economy is gonna do really well because we'll have more people who are willing to work because they're more healthier now and they're not bedridden or out of a job because they keep having to get medical treatments done. So yes, I do definitely agree with that. So do you think that we have a moral obligation to provide healthcare to everyone as needed, or is healthcare a commodity that should be subject to the same marketplace influences as other commodities? Now, this is something that's brought up by a lot of people from the right side. They think that regulations should be stripped down. They think the market will talk for itself. In economics, we learn that when you're giving products to the consumers will decide the price, because if they don't want to buy from you, they'll buy from somebody else. So what do you think on this? Do we have that moral obligation to provide healthcare to everyone?
Um, yes, I would say that healthcare in general should be something that people have access to. I think that whole topic and that whole question there's a lot of interesting stuff to unpack as well. I'll let Jasmine talk about her thoughts.
Colin knows that like this is like my type of question, basically.
Uh-huh.
My whole Even though I try and not bring like my moral side into this, it's like lives, lives, lives. I mean, come on, lives are pretty important, I'd say. But like, I know that there's more that like conservatives like to argue that you need to think more logistically. But if you just think of it in numbers, okay, these people are dying. How do they not die? And you don't have to think of it as like people just dying. It's just like how people are impacted by it like on a daily basis. And we have a moral obligation to make sure that people don't die because it's the government's duty to protect its people. Whether you're shoving billions of dollars into the military or shoving money into healthcare. Like it
Hmm.
should be the same thing. You have to protect the American people from, for example, Corona. Corona right now, the same conservatives who are arguing that the freer the market, the freer the people, put that in. That's a very famous political compass question. The freer
Hmm.
the market, the
Yeah.
freer the people. But in reality, if you apply that to healthcare, you can say the same thing with coronavirus. They're like, guys, just go out there. Like, I value my life, but I just want to make sure my children live in a good economy. So, guys, go out there, buy some popcorn or whatever. It's it's so
Yeah,
stupid.
yeah, and you see the government right now, sending checks of $1,200 to people, basically giving out free money, and free coronavirus testing, which comes under healthcare. So they're basically giving free healthcare to people, and now, and it's just like the whole thing with UBI and Andrew Yang about how he's talking about giving $1,000, and now you see the government not giving 1,000 but $1,200 to every adult. So it's true. I mean, we see some conservatives, in the White House right now. Uh, in dire times, they see how valuable, I guess, universal health care could be to its general population, and that is something very important. Now I just want to move on to some other things. So, like some people point out that in different countries, when they're talking about implementing healthcare, it's important to understand that most countries that do practice universal healthcare are not even close to the population size as the U.S. Now, I would think it would be more difficult to actually implement and manage universal healthcare in a country as big as the United States. So, what is your take on this? The amount of hospitals that the government's going to have to run, the amount of people they're going to have to pay. It's a huge country with over 200 million people. Do you really think it's possible for our government to implement and run something this big?
Could I hit this one
Yeah.
Yeah,
first?
yeah, go ahead.
So, I think that theoretically it is possible for our government to do that, but one of the biggest things that's prevented me from becoming a supporter of what is it, Medicare for All in general, is that the
Hmm.
U.S. government is extremely corrupt and extremely bad at money. If it has the
Uh-huh.
opportunity, it's going to waste money. So I think that best, or at least if we are trying to move down the Medicare for All route, we're going to need drastic improvements in credibility with where that money's going and how we're actually going to be using it properly.
Well,
Okay,
that's
yeah.
something that also isn't very like conservative sounding, but that's why you need more regulation from the government to make sure that you aren't allowed to be irresponsible with the money.
I think the simplicity of how we go about things is also important. The simpler, the better, to some degree. If we just make redundant regulations, it's not going to provide a system in which we can actually move forward to reach a goal. So if we just make simple guidelines, a very simple system, and that's kind of the benefit of universal healthcare in the U.S. We can get rid of all the complexities of it. Where could money be going right now? Just take it all away, make it one system, easy, take care of it, right?
Yeah, and that is true. It does become a lot more simple. When you have the private sector taking over healthcare in a country, the administrative costs are extreme. The amount of money that it takes to just keeping track so many different types of healthcare, especially in the United States, we have so many different kinds like Medicaid, Medicare, private insurance, veterans have their own sort of insurance. Like, there's so many different types, and the administration costs are kind of intense.
Oh,
And,
exactly.
with one system with one system, you are right. I feel like, some of that stress does go down and the costs do become a lot lower. So yeah, that is, I do definitely agree with that. I just want to switch to one a point that Ben Shapiro made. Now we know that he is, a famous speaker on the conservative side. He's given lots of speeches. I myself have watched a lot of it to know what his views are, and he's a very good speaker. And when Ben Shapiro was confronted by someone at one of his speeches on its criticism of healthcare. Um, uh, Basically what he said, that countries like Sweden and Switzerland have healthcare that is universal with high quality, but they sacrifice so much more. So he says that there are three things that a country could have when it comes to choosing their healthcare. You could have affordability, quality, or universality. And out of those three, a country could only have two. And he says most of these countries usually choose quality and universality, but they don't get affordability, meaning that it's not affordable to their citizens. It's very expensive. They have high tax rates. I think Sweden has like a 70% tax rate just for healthcare. So things like that. So I want to know what your view is on what Ben Shapiro said, because he believes there are only three things: universality, affordability, and quality. And when a country's trying to develop a universal healthcare or any healthcare system, you can only have two out of the three. So I know, Colin, you're very interested on this, so I want to give you a chance to say what you think about this.
Yeah, I actually do agree with him in the fact that you can only really have two of those three to be maximized. You have to give up one to have the two optimized. So another thing to talk about here is that right here on the quote, I think, okay, so the free market allow the consumer to decide the price and drug companies, etc. One thing that I think could be done is look into the length of patents. Innovation is good. Innovation is a good thing, and if you decrease the time that these patents are, you basically allow for competition to enter the market more quickly. So that would be almost more of a free market stance. But I think in a lot of cases, if you're arguing socialism versus what the U.S. has right now, what the U.S. has right now is basically regulation on the free market. But if we had more of a free market system, I actually think we could have some of those benefits that we want on either side of the spectrum.
So you believe slowing down the regulation and allowing the free market to thrive by itself, by what you said, reducing the time that your patents have power,
exactly, allow somebody else to enter that market.
Okay, yeah, and that is a very good point. So then you would be choosing more of the affordability and quality over the universality in that case.
Yeah, in that case, yeah. But I definitely want the innovation that comes with a free market, because that's probably the strongest argument that a free market economy has, and that applies in healthcare as well. So there will probably be companies, no matter what, making drugs or taking care of healthcare. So regardless of the system, you're going to need innovation and competition to bring about a better product over time.
But
in the United States. Oh, yeah. Sorry. Go ahead.
No, you're fine. But I just say, by trusting the market, you're saying we should trust these companies more than our actual government that the people elect through democracy.
Well, not really.
Well,
you're putting more trust into the consumers. So you're putting more trust into the consumers to choose the right company to buy their medicine or technology from.
I would say that
because
keep going. I didn't mean to cut you off.
Oh yeah. So if I was selling a water bottle that was like $5, and then my patent runs out after a year or whatever, and then Colin starts producing the same water bottle, but it has a lot more qualities. It's a lot more efficient, maybe, and he's selling it at a cheaper price. Consumers are going to go to him other than me, and then I'm going to get pissed. I'm going to be like, no, I want that market back. So it motivates me to innovate and make an even better water bottle than he can, in order to win back some of those consumers.
But that's the thing, though. So basically, you're treating it like a hot new product instead of something that people need to live.
Well, drugs kind of are. You still, right now we don't have perfect drugs to deal with every issue.
That's the whole argument, that you shouldn't be treating like these medical devices and treatments as though, they're like the new toy on the shelf. You have to treat them like something that everyone needs.
That's
Mhm.
Sure,
yeah.
you can bring in the competition in it, but you need to guarantee that people can access it in the first
hmm
place.
That's an interesting
Yeah.
point, and I think that government working with the private sector, specifically what I'm interested in space, the Commercial Crew Program, you have multiple providers, and they've both got similar-ish help in terms of financial and different developmental things from NASA. But at the end of the day, NASA, um, public organization, of course, uh,
Mhm.
run by the government, they're going to be choosing from that free market who can provide the best product, which right
Yes.
now they're, yeah. But basically, like, even if you did have universal health care, you could have companies that are selling to the government or to these government owned hospitals, however you're going to deal with it. But
Mhm.
You can have all the creativity and innovation you want. You have to just make sure the government can make sure that none of it's corrupted or it's not completely monitored.
Well, okay. So, Jasmine, the way that I see it is that if you have, universal healthcare, you are forfeiting innovation because everything is government run. So it's determined by the administration every 4 to 8 years.
You're
So if
saying
you
we
have
have that
somebody,
innovation now? Do we have that
what?
innovation right now? There's like no research and development. Like the funds for research and development isn't even that big in the first place here right now.
Exactly, but like that's what I'm saying because all the private sector is taking care of it. Like the Mayo Clinic, for instance, situated right here in Minnesota. I mean, they produce some of the best medical technologies in the world. I mean, America is one of the world leaders in healthcare.
Here's the thing: those are the research centers. By by putting in Medicare for all, you're not getting rid of all those research centers. You're not getting rid of the Mayo Clinic. You're getting rid of the administrative cost. You're getting rid of the insurance companies. The insurance companies aren't doing crap when it comes to research and development.
But I do believe that insurance companies and these research facilities, they all have a connection. Now, some insurance companies might want to offer some services that other insurance companies are not able to because of a partnership with a research firm on healthcare and them finding something interesting, something new. You know what I
What
mean?
you do, you get rid of the third party, the insurance company, and the people who are rocketing these costs so highly in the first place. You create the connection between like the government and the research facilities and the hospitals, and how they're going to get more money is even though taxes will go higher and it'll cost more for them to create the actual products and do the actual research. For example, there will be like things like you won't have to pay for healthcare for your workers anymore. You won't have to pay your own out of pocket costs. You won't have to pay the fees that it costs to like transmit and communicate, and you don't even have to pay for the cost that it takes to include the insurance companies in this relationship in the first place, which is proven to take like a big chunk of the actual cost. So
Okay, so I mean, like, okay, so everything that is run by the government has funding every year through Congress, correct? So for instance, if we have, so let's just say the universal health care gets passed in the US, it's all going well the way that we wanted it. But then all of a sudden we get a really conservative president in the White House and a conservative Congress. They have the power to reduce funding. They have the power to reduce funding for government
they
health
still
care.
do right now.
It's just like the case in Britain though. Because in Britain the NHS is losing funding from the government. I mean, a couple of years ago, they lost so much, like 600 something million pounds or something. They lost all that money from funding to healthcare, and now their government healthcare infrastructure is falling. So you could come into troubles like these if you have universal healthcare, because it's all controlled by the government, and they decide. And whatever the administration is that year, or whatever the budget that the Congress decides, that's just going to be it, and there's no changing that.
Here's what I'll add about this too, though. When like with how this climate is changing, like in America, basically the thing is that Medicare for all isn't really just about healthcare. You know, it was like the forefront policy for like Bernie's campaign. It's more about like this symbol of just completely getting rid of corruption in general. I believe that Medicare for all won't work as efficiently in a government that is slightly like corrupted or isn't completely like when there's still money in politics basically.
Hmm.
But I think Medicare for all wasn't really meant to be like a huge bill that was like all of a sudden implemented in a government where money still plays a huge part in politics. Medicare for All is this policy that was popularized by this politician to get more people involved in democracy, to keep voting and to keep voting to make sure that they eventually get people in office who are going to work as hard as they can to make sure that money in general aren't into politics. That is why Medicare for All, I think, is something that I admire so much.
Okay, and
It's
and when these politicians do get into office and they pass Medicare for all, are you fine, or is America fine with paying a huge sum of tax money towards the government every single year? Countries like Sweden and Switzerland have a 55%
I'm glad
tax
you
rate
mentioned that. I'm
if
so
you
glad
if you
mentioned
make under $70,000. If you
No,
make under
I
$70,000, you're taxed at 55%.
yeah, but I love that you brought that point up because there's this one thing that people love about Medicare for All. You pay higher taxes, but you pay so much less in out-of-pocket expense, and you don't pay for insurance. You don't pay any out-of-pocket expense. That's just eliminated. So basically,
Now,
and
now
Bernie
it is
Sanders is saying
true.
that it's cheaper then. That
Okay,
then
so
it's cheap if you eliminate that.
but I see where you're coming at. It's true that you're not going to be paying much if and only if you are somebody who has a big medical condition. If you need a lot of surgeries or things like that, sure, then that means you're not going to be paying a lot of money. But how about the people who have to pay a lot of money for care that they didn't receive? If you're just going to go in for a regular 1 year checkup and maybe go in when you get like a fever or something, do you really have to pay a 55% tax rate when you're not even going in for that much? At that point, you'll probably be paying more than you would if you just had regular private insurance.
But here's the thing, though. It's basically you would pay for that insurance anyways. So like, okay, if you let's just say, okay, here's the thing: you weren't either super poor where you couldn't afford healthcare in the first place, or you weren't like bombarded with medical bills to the place you can't like you can't economically like continue on. So basically, you're this normal middle class family. You're gonna still pay for that insurance to be covered because you don't want to risk it. So you're still paying for it.
Okay, so if you have, for instance, let's just say, okay, so right now with private insurance, this is just an example out of the blue. Let's just say you're paying $100 a month for your private insurance. Well, let's just say that, okay? Now, all of a sudden, we have universal health care. You're a regular, healthy citizen. You're doing fine. And now, all of a sudden, you have to pay four or $500 instead of the regular $100. Now, that's going to piss you off, and you're going to be losing lots of money because you had better health care technically before.
No,
What?
that's the thing. You won't be losing money because, okay, the tax rates go up, but Bernie Sanders' plan basically like, so he does admit it's going to cost $32 trillion, which is going to be Bernie Sanders has
Wait, how much?
reviews. That's like the way that they're predicting. It's like $32 trillion. Is that what they're saying? Bernie
32
Sanders
trillion?
No, I think it was somewhere around the 20 something.
Yeah, but it was like somewhere between 20.
For how long?
It goes like 20 trillion. Some people say it's 40 trillion. It really depends, but like I think like I think it's like about
Here, I'm actually searching it up right now. It would cost, sorry, according to BBC News, it would cost $40 trillion in government spending over the next decade.
Okay,
Now,
so
that is a
4 trillion
shit
a
ton
year.
of money.
yeah,
That's
but
a shit ton of money. 4 trillion, that's like half the budget. Well, not half, but like it's like a quarter of the budget. That's like crazy. That's a lot of money though.
Yeah, but that's what they're saying. You're already paying so much money in like Wall Street bailouts and etc.
That would be the
You're-
whole
you're
budget,
paying-
basically.
Yeah.
but basically that's over the next 10 years though. That's
No, so the budget, the federal budget in 2015, for example, was 3.8 trillion. So
Oh, sorry. When I said 25%, I meant the GDP. I mean.
GDP, yeah.
GDP, yeah.
Oh, so like right now, we still spend more per GDP than France when it comes to like medical and healthcare, and France technically has like the best healthcare system. Well, it was like ranked number 1 in like 2000, but
Mhm.
America is still spending more in GDP. So we're still spending a crap ton of money to cover for these drug companies. instead of actually helping our people. That's the main point of Medicare for all. It's like,
Okay, so like, okay, so see, it would make sense if you were to say, let's take the per capita amount that we spend per American right now, which is an insane amount of money, and let's take all that money and make that into a universal healthcare system. Now, if you were to say that, I don't think you would get as much backlash because you're using the already existing money that you've been using for all these years to do something new that could probably benefit more people and possibly maybe cost less or most likely cost more, cost a little bit more. Now that would be fine, but in this case, you're talking about a government spending like I mean so much more than how much it costs right now to run healthcare in America.
well, the cost
And
effect
that means
out when you're completely
I know,
with the third party.
but I mean here's the thing: if you're going to fund healthcare through so much money, you're going to have to take money away from somewhere, whether that be education or military spending,
You're
and
gonna take it out of Wall Street bailouts. You're gonna take it out of corruption. That's what the plan basically is. Basically, why? Okay, so like the same person advocating for this Medicare for all plans was also arguing for free public education.
Okay, but like so if Bernie Sanders, let's just say, became president all of a sudden, and he is trying to pass universal health care, his main thing, he wants to do it, right? It's probably going to be extremely difficult to get it passed through Congress before there's a split in Congress. Now we know that as soon as we have a president and then we have elections in Congress, like the House or the Senate goes to the other party. Now in this case, the Democrats got the House right now with Trump, and the Republicans got the Senate. If we're met with a similar situation with Bernie Sanders, and he's not able to get it passed while Democrats have a majority, there's no way he's going to be able to get it passed.
Well, here's
It's
the thing.
extremely difficult.
I vote based on like what I think is truly right. I don't. For example, if I think a politician can pass more bills that I hate versus a candidate that like is fighting for something that I believe in, I'm gonna vote for the candidate who I think is fighting for what I believe in the first place. But honestly, if I'm being completely honest, yeah, it'll be impossible to tell how Medicare will fully incorporate into our current system. Like you can't know for sure exactly how it's going to work out, exactly how it's going to cost, exactly how much it's going to save people money. We don't know because it's such a drastic change in our system. And yeah, the conservatives are kind of right in saying America is a very different system, but there is evidence proving that Medicare for all works in other countries and works in other systems as well. And we know right now our healthcare system is not working right now. So Medicare for all is basically taking this chance to fight for a basic right for everyone else. And I just like want to talk to like Colin about this. It's like with your conservative, more conservative lens, it's basically like, yeah, you can put in the free market and put in research development, but isn't the whole point of this is just making sure people get healthcare?
Yes. The end goal is to give people healthcare, and even from the most selfish possible side of this argument, you could argue still that you don't want to live in a world where half of the population, for example, has zero healthcare and is just dying away and withering away because they have no access to healthcare. So even if you are that person who is the most selfish, zero care for people, right? It would still not be really an ideal way to walk around the streets and see people that are suffering because they have no access to healthcare. So
yeah, and I believe, at least I want to believe that politicians on the left and right, they all want to provide the best for the American population in their own ideological sense. I mean, everybody wants everybody to be healthy and happy. It's just the different methods that become a conflict when dealing with it.
Go out and vote during coronavirus, risking lives.
Yeah,
they
yeah.
really care about the people then.
Are you talking about Joe Biden?
Well, yeah, Joe
are
Biden
you?
put into that. Like the Wisconsin senator.
Oh yeah.
The Wisconsin held it. Basically, it's Medicare for all isn't something that's going to happen tomorrow. but
Yeah, I
it's
mean, it's definitely like, many news outlets, when Bernie Sanders dropped out, said that this is only just like the beginning of a movement. He started a
Oh
big
yeah.
movement, and this is something that's going to not happen now, but in the future, I mean, well within our lifetime, we're going to see some big liberal movement to bring universality to a lot of things in government. So it's just a matter of time. Bernie Sanders will probably be known as the person who started a revolution like this, and it's definitely a big step in our history.
whether you like
You know,
this or not, it's exactly that.
I
He
was
kind of
literally going to say the same thing.
yeah.
yeah, and I mean, yeah. So I mean, we're gonna see what happens. But quickly, as talking about universal healthcare, one issue that a main issue that the right brings up frequently, very very frequently, is waiting times. Now, I watched a video. I'm not sure if you guys are familiar with Steven Crowder.
Oh yeah.
He has a podcast called Louder with Crowder, I believe.
Yeah, he does.
Yeah.
Yeah. And he did this thing where basically he went to Canada, right? And he's a dual citizen. He lives so he can live in Canada and the US. And he basically went to Canada, had some of his friends, just go in with like a fake injury, like I think it was like a broken wrist or something. And they basically apparently had to wait for 5 or 6 hours just to see a doctor. And at the end of the day they couldn't, so they left. And the video was cut a bunch of times, and I felt like this is probably done to show universal healthcare in a bad way. So I watched like a debunking video, and even in the debunking videos, all of them do admit the fact that when you have universal healthcare, very small things, like if you have like a slightly broken leg, or I don't know, a small cut, or whatever it may be, like small injuries, you're gonna have to wait for a very very long time.
Mhm.
And I'm not sure if people are really ready to wait 6 or 7 hours if they have a broken wrist. I mean, sure, you're gonna get expedited healthcare or care for people who are in dire need, like cancer patients or people who need surgeries right now. Those people are gonna get it right away. But the regular daily person who's going in to get checked up or things like that, it's an intense waiting period. I mean, do you want to wait 6 to like 8 hours just to see a doctor?
I mean, even if that was like dramatized or not, it's I don't okay. Even if that was like blown out of proportion or not, basically, I mean, personally, I think I have a different lens on this because I have a more personal like aspect to this, like with my own family having like medical problems, like my mom when like she was like a cancer patient too.
Uh-huh.
Basically, I'd be willing to wait for a broken bone to make sure that everyone in America doesn't, get exploited by the healthcare system, including myself. I just
Yeah.
I think it's a moral obligation to just be like, like yeah, you have to make some adjustments. Basically, yeah, I take it. Like I think it
Mhm.
doesn't really work out the other way.
Yeah, and so Colin, what do you think about this? About the waiting times?
I definitely recognize it. I have family that has been living in Canada for 10 years or something. They're citizens there,
Mhm.
and they have experienced that problem actually with their young son.
Mhm.
I think I mean, of course, it's a real thing to some degree. I don't entirely know how to fix it other than just providing more qualified people, doctors and nurses and stuff that could take care of the problem. I think it would be not that hard of a fix as long as you're not having people come in for useless things just because they can.
What I
Yeah,
think
and that's like one of the things that some people say is that if you have something like universal health care, and I know people talk about like the preventative care or whatever, stop it before it starts type of thing. But when you have universal health care, like Colin, you were saying, people are less careful about going to the hospital. They're like, oh, I have a tummy ache, I'm just gonna go. When here in the US, if you have a tummy ache, you kind of deal with it, take something to like slow it down or whatever, or like cover it up. But then you're gonna have so many people just walking in just for simple things that it hurts the administration. Like when you have when you have like 12 doctors in a hospital, and let's just say each doctor was only capable of taking care of 10 patients per day, and if you overload them with 20 patients per day, you're going to have to admit that you're going to see that the doctors start to start to pay less attention to their patients, or give them, a I don't know how to word this, a worser care experience to the last 10 than the first 10. So you experience problems like these with universal healthcare. Now, I know that these are stuff to keep in mind when doing it. People in Canada do know that their system also has flaws. But then I go back to the point where, then again, it's run by the government, and the government gets to decide how it's run with budget cuts and things like that. So I don't know. Is there anything else you guys want to add?
Waiting times in Canada, but you also see people traveling to Canada to make sure that they can get insulin because they have diabetes and they don't want to die, and it costs like hundreds of dollars here. So
yeah, and and that's something that I'm for, like being able to provide medicine that is that is at a lower cost is extremely important. You don't want to have people paying, I think, for like EpiPens, like at one point, like thousands of dollars. I don't even know. Like, it's crazy. It's a crazy amount of money just to keep yourself alive. And I think that's not viable. I think the government intervention is required, where they do provide some sort of regulation, a fair price. It doesn't have to be dirt cheap, but something that's fair, something that the consumer can afford, while providing a profit to the company, but also being able to save their own lives. I think that's definitely important.
And here, I'll say this: it's like we all live in Maple Grove, and even though I don't live in like the richest part of like Maple Grove, like townhouse like area, it's like you still are kind of like desensitized to like how much Medicare for all would actually like help your community. But like when you like in previous communities that I lived in, for example, like I literally lived in like straight up Rust Belt, Pennsylvania. You really notice how much like America needs Medicare for all. Maple Grove's like the one place where people can't really feel it. But like straight out like in Pennsylvania, and like when you live there and you just see people like struggling like on a daily basis, it's like you can't like get it out of your mind living here. It's like, yeah, everyone can afford it here, so it doesn't matter. It's a whole other world out there, and we can't ignore it.
I actually agree with that sentiment a lot. I go on mission trips in the summer. This one was canceled because of coronavirus, but they are out in basically coal country in West Virginia in the U.S. and the things that you see there, it's not what we see in relatively well-off areas of the country. So I don't think that people should stand up on their high horse and think that everybody lives a life like them, because really, for things like UBI or universal healthcare, I think that a lot of communities could be helped, regardless of if you believe in them or not. There are a lot of communities that would actually see a lot of benefit from them. So I can't deny that at all.
Yeah. And yes, I mean, that is true. There are lots of communities in the United States, like you guys were saying, that definitely require universal health care because of that city situation or state situation, or the way the government is handling it there, or however corrupt it may be. Sometimes universal health care in some places may be sound amazing. Us living in Maple Grove, we don't really feel the effects. So definitely. One final question to quickly finish off this podcast. I just want to get your take from both of you. What system of universal healthcare should America adopt? So like specifically, like, what country? I'm not looking for deep specifics, but like what country and what specific things from that country do you think the American government should adopt to their healthcare system? Because we have like Canada, Denmark, Sweden, Switzerland. We have a lot of countries which have it. So which system do you guys prefer, or which country's system?
Probably something similar to Denmark, but in a more like expansive scale. I don't know what Colin would say, but
could you like expand on like Denmark's healthcare? Like
it's basically
the basic.
It's basically Medicare for all, and just like guaranteeing people the best quality of life possible across the board.
Okay. And Colin?
I don't know firsthand which country that I would like. hope for the most. I think that
Uh-huh.
like the whole theoretical idea, what the optimal way to go about things would be, probably be
Mhm.
just strip everything away and have one very simple universal healthcare system. But
Yep.
the way I'm reading this, and I might be wrong, but something like the UK system,
Okay.
perhaps
So like the
appeals to
NHS
me.
sort of. Uh-huh.
Um, but yeah, I'm not entirely sure exactly. Oh yeah, this one includes, yeah. So I've
Mhm.
particularly heard some really good things about the experiences that people have heard, and they're anecdotal, but
Yeah.
all that I've heard about those healthcare systems is people really like them. The care is good. The people are passionate about helping people, and generally, it's a good thing. And yeah,
Yeah,
I think that
and
might be a good way to go about it.
while doing my research, I can say the same thing. Like while doing my research on like Britain's healthcare system, I see a lot of videos where people actually do praise it, and the citizens do very much like what they have, and they rather prefer it than anything else. So,
Mm-hmm.
I do agree with that. Well, before we do close off, I just want to thank you guys, Jasmine and Colin, for taking time out of your day, showing up, and having an awesome conversation with me about universal healthcare. It really does mean a lot to me.
Oh,
Yeah.
thank you for having us.
Yeah, man, of course, anytime. And quickly, I just want to give a shout out to Bring Change to Mind. This is something that I know Jasmine is heavily into and is participating in a lot. It's more commonly known as BC2M. Maybe you guys know about it. And its mission is to end the stigma and discrimination surrounding mental illness. Bring Change to Mind also brings programs into high schools to teach youth about the importance of mental health, and they have achieved great success by starting many chapters all over the country. If you're listening from somewhere else, maybe in your own high school, you might have a chapter. If you're interested in learning more about mental health or starting your own high school chapter, please do visit bringchangetomind.org, and the two is the number two, not TWO, just so you guys know. So it's bringchangetomind.org. And finally, I just want to thank you all, the listeners, who are taking time out of your day to listen and help bridge that political divide. Our next podcast will be this Friday, where I do a review on all of the important things that are going on in the world from this week. Also, our topic for next week's podcast will be the Democratic presidential election. We'll have another guest on, and that will be released Monday the 20th. So stay tuned for that, for another awesome guest and a great discussion. Until then, see you guys all later.